So good afternoon, everyone. Thank you for joining us again today. I'm Irene Quezon. I am the Regional Emergency GBV Advisor for Asia Pacific. Just before we start, this webinar is recorded. So if you have any questions around it, please feel free to reach out to the Secretariat or to me specifically. So on behalf of the Asia Pacific GBVIE or Gender-Based Violence and Emergency Working Group, we're happy to welcome you to the Risk Mitigation Series. This is the third series of the three-part series we're hosting for this year on risk mitigation. This is our third and last for the year on this risk mitigation. The webinar is co-hosted with our colleagues from UNFPA, UNICEF, IOM, and the PSCA from Asia Pacific region. We also purposely hosting this event alongside the 16 days of activism against gender-based violence campaign to commemorate, but also to reinforce our advocacy to raise awareness, to end all violence, to end all forms of gender-based violence, and drive action towards supporting our survivors of gender-based violence. So before I read out the outline, we will be accommodating questions after all our presentations. So if you feel free to type in your questions in our chat box. So let me read out the outline. So double checking if I'm recording today. So we'll start with an overview of the M&E GBV risk mitigation, which will be led by UNICEF colleagues, and then move you over to the guidelines of M&E components for GBV and GBV specialists or gender-based violence specialists and non-specialists, which will be led by our UNFPA colleagues. And then we'll take a country case study in South Sudan, and then accommodate all the questions, Q&A and discussion, and then we'll wrap it up with key messages. Before I move you over to Sarah from UNFPA, let me just introduce ourselves for those who are new in this space. We are the Asia Pacific Gender-Based Violence and Emergency Working Group. We are an interagency team created to enhance capacity building and technical expertise on gender-based violence and emergency in the region or Asia Pacific region. We facilitate a number of activities, including webinars such as this one. If you have questions or even suggestions for future webinars, feel free to contact us. You have the email of Sujata there, who is the chair for the WG, and I'm Irene. I'm the co-chair for the working group. So I'll stop here and give the floor to Sarah from UNFPA. I'll allow all the experts to introduce themselves. I don't think I can perfectly capture the experts we have in the room, but I'll allow Sarah to introduce herself and then kick off our discussion for today. Thank you. Over to you, Sarah.
Thank you, Irene, and welcome everyone. My name is Sarah Baird. I'm with UNFPA's Asian Pacific Regional Office, and I'm a GBV technical specialist. Really happy to see you all here today. As Irene mentioned, we've come to the last webinar in the series for the year, and we're focusing on what is a sometimes complex and often sensitive area, which is monitoring and evaluation for GBV risk mitigation. So we know that M&E for GBV risk mitigation has to take a system-wide approach. It's interlinked across sectors, different actors, different organizations, but at the same time, we also know that there is not a system-wide common understanding of how to monitor risks, how to collect and interpret data to reveal what mitigation measures are needed, and how they may change over time, and how to safely report on results. So GBV, i.e. specialist agencies, play an important advisory role in supporting our counterparts in other sectors to fulfill their responsibilities for preventing and mitigating GBV, and that includes understanding the particular sensitivities and the best practices around M&E for GBV risk mitigation. I'm really excited about our lineup of presenters today. I think we're all going to learn a lot, and I'm looking forward to learning from their experience. So I will kick off by handing over to Selena from UNICEF, who is our first presenter. Selena?
Thank you, Sarah. Thank you, Irene. Good afternoon, everybody. This is Serena, and I work for UNICEF. I'm part of the GBV HQ team, and I lead on the information management portfolio. So I'm going to give a general overview of M&E with relation to GBV risk mitigation in this coming section of the webinar. To start with, when we talk about monitoring and evaluation, I think for most of us, the first thing that comes to our mind is indicators, which is hugely true. We, of course, need indicators to set up an M&D system, but I also want to highlight that this also includes like tools and processes, field monitoring activities to measure the actual results of the programming. And in addition to the general M&D concept, is that in specific for GBV risk mitigation, it holds a high value. So although we do not actually need a proof to start implementing GBV risk mitigation measures, however, it comes very handy and very valuable if we integrate the measurement of GBV risk mitigation into our M&E systems. They are very valuable to test out if we are putting the specific risk mitigation measures in the right place, but also it is very important when it comes to coordination, advocacy, and also resource mobilization. So I would say to start from here, saying that if we don't count at all what we are doing in GBV risk mitigation, we might have difficulty in counting it in different pieces of the program cycle. So to start with, when it comes to GBV risk mitigation M&E, there are two major components. So we're speaking about monitoring GBV risks that are relevant to a specific sector or program. This is one piece. And the other piece is after we implement GBV risk mitigation strategies, we want to monitor, we want to monitor the effectiveness of these measures that have been implemented. And I think all the activities that we do under the GBV risk mitigation M&E falls into monitoring and evaluating these two components. Next, please. So an important thing to say here is that while it's important to do assessments at the beginning of any program cycle and to gather information on GBV risks and also on possible GBV risk mitigation strategies, it's important to note that when we are talking about M&E, it's better if we integrate it throughout the program cycle and not do it only at the beginning. So here are some of the GBV entry points in any program cycle. It can start, of course, with the assessment when we are designing the log frames, when we are, selecting indicators, on the general M&E plan, but also, any opportunity we have at the mid of the program cycle during implementation, we have to do monitoring and evaluation. It's advisable, whether that is through routine monitoring or if we are doing, mid-program review or we're collecting data for progress reports, then it's also important in, the in the middle of the program cycle during implementation to revise again these two components, the GBV risks, but also the effectiveness of GBV risk mitigation measures. Again, at the end of the program, it can be, in a form of, final formal evaluation or just, the final reports, if we're generating lessons learned, collecting these type of data, then the integration of GBV risk mitigation M&E is important. So I'm going to go through what is recommended in terms of activities under GBV risk mitigation MNT, what is not recommended. So some of the examples of the recommended activities is actually interviewing women and girls to know, about their safety perceptions, or it could be at the mid of the program, examining the efficiency of the risk mitigation strategies. While it's not recommended to try to actively seek information about GBV cases in the community, or try to take GBV survivors and have a consultation with them or interview them as not part of the whole community, and then or documenting detailed information about individual survivors or perpetrators, or even looking at prevalence. And this is very important to note that when we are looking at GBV risks and monitoring GBV risks, we're looking more at the likelihood of a GBV happening. So we're not in any way trying to find out or collect data on actual GBV forms or GBV incidents. So having said that, I would say that on top of the fact that they are not recommended for risk mitigation M&E, if they are not done correctly and with specific parameters, this can cause some level of harm to the GBV survivors. If we are trying to collect, reviewing GBV survivors, or trying to collect data about prevalence, or trying to document forms and types of gender-based violence. So having said that, there is also a link that I want to highlight between GBV risk mitigation, M&E, and GBV reporting. So the increase or decrease in reporting of incidents of GBV is not in any way indicative of increase or decrease in the GBV risks. And it's not also indicative of success or failure of GBV risk mitigation interventions. For example, if we are implementing in a certain location GBV risk mitigation measures, and when we are doing monitoring activities, we find out that the reporting on GBV incidents have decreased. We cannot conclude from this that the GBV risks have decreased, because there are multiple factors that might play a role in having a decrease or decrease in reporting. For example, if a safe women and girls safe space closes for some reason, then we will, of course, witness a decrease in reporting. While on the other hand, if there is more visibility of GBV case management and more communication and information dissemination with women and girls about it, then the reporting might increase. However, this is only linked to reports of incidents of GBV, and they are not indicative of in any way on increase or decrease of GBV risks, and either success or failure of GBV risk mitigation intervention. That's why we do not recommend for anyone doing GBV risk mitigation M&E to try and triangulate the data about the changes in reporting of GBV incidents to what we are trying to measure in terms of either risks or GBV risk mitigation measures. So here are some, good examples of practice of GBV risk mitigation M&E. I know that for some of you who have attended previous sessions of this series, you might have, had this discussion around either AAQ framework or consultation with women and girls and safety audits. However, it pops out again here in MND because it's important to note that this list of good practices in integrating integrating GBV risk mitigation in M&E are not supposed to happen only at the beginning of the project or program. For example, consultations, this is also M&E. It should happen periodically, safety audits as well. So I'm going to go through very briefly through each one of them to give you just a glimpse of what we mean by using these practices for GBV risk mitigation M&E. So to start with the GBV risk mitigation indicator selection, I just put here an example coming from UNICEF. It's a tip sheet where you can find a list of GBV risk mitigation indicators. I know that there are also other resources that you might want to resort to. So it's just an example, but if you are interested in looking more in depth at this tip sheet, then you can find the link at the bottom of this slide. So one way is to actually select indicators, qualitative and quantitative, and integrate them in the M&E systems to make sure that these pieces are regularly monitored. The second good example of M&E is the AAQ framework and adapting it to GBV risk mitigation. AAQ framework, for those of you who do not know, refers to the availability, accessibility, acceptability, and quality of services. And there is a list of questions under each of these domains to measure them. I think it's a great tool if you want to, monitor a specific service or a specific facility, let's say a nutrition facility or a health clinic, to adapt the AAQ framework questions and measure safety perceptions of women and girls over these 4 domains. Again, availability, accessibility, acceptability, and quality. It can give a lot of valuable information and insight about, how the setup of the facility or the project is affecting the safety of women and girls, or the perception of safety of women and girls. So again, this is a great tool. And now I'm going to move to the third good practice, which is, I'm sure you've heard of it, consultation with women and girls, but when we refer to it in the context of M&E, this is more of a periodic activity that is integrated in the M&E systems. So the first thing to say about it is that many people think that this should be, a standalone activity where we dedicate resources and where we dedicate, specific time for doing consultations. On the contrary, this should be actually integrated in regular and routine consultations during the program cycle. I have to say that it can happen at any moment during the project, and can provide, unique insights on the safety risks and also protective factors. And here is also, in a nutshell, a list of types of activities that you can do to collect data for consultation with women and girls. So moving to safety audits. So safety audits focus on the physical structure and layout and location of service points, distribution, etc. While when the safety audits were initially developed, it used to be developed for camp setting, but now we can safely say that it can be used we have tools to use them in any geographical locations that have specific boundaries. Again, it can happen at all phases of an emergency, most useful at the beginning, at the acute onset, but also to be repeated whenever a major change in the overall context happens. It's The activities under safety audit is doing observation and consultation. But here, just to note that if there are no available resources or enough resources, observation can be through a checklist can be enough to conduct a safety audit. So again, after we have collected data in any way that we is possible for us, either through indicators or qualitatively through consultations, safety audits, etc., it's really important, and I can't stress enough how important it is to do risk analysis. It really helps us to identify if we are doing at the beginning or even choose more appropriate risk mitigation actions to implement. And it actually informs monitoring plans. For example, if we get any unintended consequences, then we might consider change in the monitoring plans. And then I just have a few tips on maximizing safety while doing these activities, whether having accessible location, appropriate timing, having female staff, ensuring, for example, that we do not ask directly about GBV incidents, but also making sure that the enumerators or the staff are well equipped to respond to any cases of GBV incidents. And before I hand over to my colleague, I just want to give you a glimpse on UNICEF work on menu of measures of GBV risk mitigation in nutrition. So for us, the most sector that we made progress towards having a system for M&E for GBV risk mitigation is nutrition. In 2022, we have developed a menu of measures. So yeah, next, please. We have developed menu of measures, and it includes both qualitative and quantitative indicators that measure these 4 domains: safety perceptions, access and barriers, and nutrition-specific outcomes, while also looking at coping strategies. It's also organized in a way that it helps the user to choose between 3 scenarios, whether there is the recommendations of indicators if there is a GBV specialist is really different from the recommendations if there is no GBV services. And then the whole M&E can range from programmatic M&E to more complex research or impact type of evaluations. And here you can see in this slide the way it is designed. This is just an overview, but I really recommend that everybody goes through the whole menu of measures. Thank you, Irene. I'm just cool.
Go ahead. Sorry. Go ahead.
If we still have, I'm not sure if I wanted to hand over to my colleague Estelle to give you a glimpse also of the.
I am. If you want to give the floor,
so if time is limited, this is not finalized yet. You're just getting fresh news. Like, I'm just going to say that we are adapting the same menu of measures for the education sector. We are approximately in the midway of this project, and I'm sure that later on it's coming your way, and it can be shared.
Thank you, Selena, for not to eat on Estelle timing. Thank you so much. I'm sorry. I'm quite cognizant of our timing. I will provide the PowerPoints with everyone. So moving over to Estelle.
Good morning. Well, good afternoon. Sorry. So I just joined. I'm sorry. Are you specifically on the education piece? Yeah.
Am I on the right slide deck for you?
I think you are. Okay. Can you hear me?
Loud and clear.
Okay, perfect. How many minutes do I have for this?
I have 5 more minutes for UNICEF colleagues. Sorry.
Okay, so I'm gonna try to be very brief. I think Sunita probably Selena already told you about the nutrition one and the work that we've doing with the education adoption. I just want to highlight the what is not on the slide, because I'm pretty sure that you will receive that. One thing that is particular with the education adaptation is that it's really built on the sector already existing M&E system. As you probably know, education has a strong standard around the safe assets, but also opportunities to equal opportunities to female and male teachers. So there's something that is really, grounded in that education M&E system. The M&E or the manual of measures for the education is also specifically based on the same measurement element like the nutrition one. And you also have a decision tree, and then the decision tree actually will help you to decide which scenario you're going to choose for the measurement. For example, we have 3 different scenarios. We have a light scenario, which is basically where there is no service, GBV service or child protection focused services available. And as you could see on the slide, whenever the answer is okay, are there services available? If the answer is no, then the focus will be on the light scenario. The light scenario has basically 3 main components. It will focus on access to education, but basically access and barriers for access. So it's going to measure whether all the GBV risk mitigation measures put in place by the program have increased access, but also retention to school. Access and retention are something are very important when it comes to education. It's also going to focus on coping strategies. And usually when we talk about coping strategy in education, it's not coping strategy for lack of education. It's basically coping strategy that are linked to other sectors, for example, lack of cash or any other system, but has an impact on the access to education. Quickly, probably I'm going to jump to the next step. What we're doing currently is in the coming month, we will do the field testing of the tool in 2 countries that have been selected. It's going to be Chad and Burkina Faso. We are also exploring the possibility to do a field testing in a country that is not an emergency contest, in development contest. Once the tool is tested in both contests, then we will have a final. It will be finalized, and then we'll start the dissemination. And the dissemination also is something that we really want to be widely disseminated, but also, embedded more and more in countries, but also in the whole education system, capacity building, but also institutionalized as a way to monitor and evaluate GBV risk mitigation interventions in the sector. I'm gonna stop here and really hope that I stayed within the 5 minutes. Of course, if you have any other questions at the end of the webinar, or if you want to reach bilaterally, I can put my contact in the chat. Thank you.
Thank you, Estelle. I'll move you over to our next speaker, Leigh Ashley.
Hi, everyone. Thanks so much. I'm Leigh Ashley Lipscomb, and I'm the Gender and Human Rights Advisor here in the Pacific Subregional Office of UNFPA in Fiji. I'm going to talk today, moving to the next slide, about what are kind of your core resources that you can go to. Anybody can pick up these 2 resources and use them, but they have different audiences and slightly different purposes, and they complement one another. So the first one on the left is the Interagency Standing Committee GBV guidelines. I think probably from your other webinars, you're already familiar with this one. And this is really your core guideline for M&E and all other parts of GBV risk mitigation if you're what we refer to as a non-specialist, which means, you're not performing GBV dedicated functions. You haven't been working on GBV for multiple years or received training, for example, but you would work in other sectors. So that's the core guideline for other sectors. If you're working on a dedicated GBV program, you have a role to support your organization as a GBV specialist, then for GBV risk mitigation, you use the GBV and emergencies minimum standards, and that's minimum standard 9. And it's interesting, not always are people aware that there is a specific minimum standard for GBV specialists. So we'll talk about these both today. Next slide, please. So let's first look at the Interagency Standing Committee GBV guidelines. What is actually required for everyone to monitor and evaluate GBV risk mitigation? And the first answer to this question is really that it depends on your role. And you've heard the expression, everyone has a role to play. Well, that includes for monitoring and evaluation. So in the GBV guidelines, there are specific checklists for different levels of the humanitarian system and different roles. And each of those checklists have a monitoring and evaluation component. So for example, there's a checklist for the UN Humanitarian Coordinator, the RCHC, your humanitarian country team, cluster lead agencies, cluster coordinators, and cluster members. So you're really moving across all the levels of the humanitarian system. In addition to that, then you have very specific guidance on monitoring evaluation by sectors at the program level, as our UNICEF colleagues have just presented. But the point I wanted everyone to be aware of is monitoring and evaluation is not just about one project or just one organization. It's really meant to be system-wide and at all levels. Next slide, please. So I'm just sharing some little snippets from these checklists. So let's say, for example, you're at the highest level. I don't think we have any RCs on the webinar today, but you might be advising an RC. So this is just to share at leadership level, their monitoring evaluation components, which means they need to identify for each sector of the humanitarian response a few indicators or areas to monitor, make sure that the highest level of leadership is receiving that monitoring information and then sharing it outwards. I also put here the government's M&E portion, and I think that's very important for any of us in the Asia Pacific who might be working in a context that doesn't have a cluster system. You might be working in a government-led humanitarian coordination system, and they have a very similar checklist to a UN cluster system, and I've shared that snippet here. So if you're advising a government-led humanitarian mechanism, there's M&E information in the core resource for them as well. Next slide, please. Now, those are leadership levels. As I mentioned, there are specific indicators and guidelines for every sector of the humanitarian response at program. So how do you monitor and evaluate your own organization's programming? And again, these are applicable whether you're an NGO, a UN agency, or even a government agency. If you're doing programming in any sector, there is an indicator for you. I've shared here a snippet of the education section, just with some sample indicators. And I wanted to demonstrate a few things. First of all, that monitoring and evaluation of risk mitigation includes both quantitative and qualitative components. Quantitative is very important, but we often need to also have a qualitative measure to understand what the numbers mean, but also to really dig in our engagement with women and girls to understand more clearly what the risks are so we can change them. You'll also see on this slide that it shows where you can get the information. So for example, for the first indicator, assessment reports or a focus group discussion. But keep in mind, you don't always have to do primary interviews. It might be safer and better to use other types of information like organizational records. It includes targets such as 50% of persons in the education committee should be female. And the checks are just whether the indicator is best measured at preparedness response or at recovery stage. The other thing I just wanted to point out here is you do not need to be a GBV specialist. Anyone can count the number of persons in the education committee who are females, right? So these indicators have been vetted and checked to see would they be safe to monitor. And not all of them require highly specialized support or complicated monitoring systems, for example. It also has indicators like this one that could apply in both a humanitarian and a development context. So just keep that in mind. Next slide, please. So now let's move on to that other resource on the right-hand side, the GBV and Emergencies Minimum Standards. And that resource really targets people who are GBV specialists. And it's meant to give a list of key actions there and really explain what is it that GBV specialists are supposed to do to support the implementation of those interagency standing committee guidelines with non-specialists. So if we have any GBV specialists on the call today, this is the list for you. If you're not a GBV specialist, this might be helpful to know what can you expect? What can you ask for? You can ask for GBV specialists from the GBV area of responsibility or GBV subcluster, or from other organizations who might be working in your sector who have a GBV specialist. And these are the kind of things you can ask for. Let me summarize so it's easier to see on the next slide what these key actions entail. So GBV specialists should be working to train everyone on GBV basics about safety, our guiding principles on confidentiality, respect, non-discrimination, and training them on those GBV guidelines. GBV specialists can also help you review your M&E frameworks to see, do they align with those GBV guidelines or other good practices for monitoring and evaluation. GBV specialists can also support engagement with women and girls. It's a nice thing to say, but it's not always easy to do, to engage with women and girls. So it's really important, if you have questions, reach out and a GBV specialist can help with that process. Analysis is done better, as Selena has always pointed out, when it's joint. So specialists and non-specialists sit together and interpret that data. And then I've underlined these next areas: supporting finding solutions and ensuring safe and ethical reporting and follow-up. And I've underlined these because, to be honest, these are our weak points as GBV specialists and non-specialists, and we need to do more of this together. It can often be easy to gather a lot of data, maybe even produce a nice safety audit report, but what matters is what we do with the report. And it might be easy to identify toilets are unsafe, but how do you solve that problem with very limited resources? And how you solve that problem might change over time. So GBV specialists should be sitting together with non-specialists and working through those solutions. And then when you're reporting, making sure that's done so in a safe and ethical way. The last key area is advocacy, and that includes supporting leadership and your teams for review and proposals across sectors. And of course, that high-level advocacy, going back to that checklist, to make sure our leadership is doing their role in monitoring and evaluation. Next slide. So let me share an example of how specialists and non-specialists can work together to implement these two guidelines. This is from Afghanistan. I think I see at least one Afghanistan colleague online. So the OCHA team in Afghanistan, who works with the pooled fund, the Afghanistan Humanitarian Fund, wanted to know, are they applying those GBV guidelines across all sectors? And if not, what more could be done? So they reached out to GBV specialists in the GBV subcluster, asked for support, and together they created a 3-week training that included both online components like this one, as well as practical exercises. Then in terms of outcomes, so what they were able to determine is looking at that, what were the key indicators, 1 or 2 indicators per sector that align to the Afghanistan Humanitarian Fund projects that they could monitor, and what was safe and ethical for the spot check teams that were not specialists to look at. And that was really important because not all organizations had a GBV specialist to go to the field. It just wasn't possible. Not even all organizations had access to the field to go at all. So by training this group of centralized M&E specialists, then there could still be GBV risk monitoring and evaluation in a safe and ethical way, if there wasn't the access or the support to do something more elaborate. And last, the non-GBV specialists raised really new concerns about remote and third-party monitoring. So sitting together, the specialists and non-specialists came up with some guidelines for third-party monitoring, again, to make sure indicators were safe. Next slide, please. The time to do all of this M&E work is now. It's your HRP season for those Myanmar, Afghanistan colleagues every year. It is whenever you have an emergency and you're developing that common plan. If you're not in an emergency, it's now when you're developing your work plans with governments, CSO partners, and your own internal projects. If you're writing proposals, the GBV guidelines has the list of indicators for you no matter what sector. And if you're a GBV specialist writing a proposal on GBV risk mitigation, there are indicators for you to include in the proposals as well. So just think and remember, now's the time. That's why there's this webinar. Please do look at the resources and those different pieces of guidance and indicators, for example, that you can integrate into your proposals and your work plans. Next slide, please. Now, I wanted to share with you transparently, we're still learning how to do this together in a better way. So 2 years ago, UNFPA with the Global Interagency Standing Committee Guidelines Group worked together to study how can we improve our work together on GBV risk mitigation. And what we learned is that GBV specialists like myself are very bad at speaking and training other sectors. So some key things we learned in the process, it's really important not to use GBV language, but you can monitor and evaluate using the existing standards in SPHERE, for example, or the minimum standards for child protection, minimum standards for WASH. You can use those existing resources in the sector and really draw on the sector's resources, not always from GBV resources. We also learned it is really not a great idea to train a lot of GBV specialists with non-specialists because the GBV specialists tend to dominate and there's not enough space for non-specialists to ask questions and really be able to step up and lead and make the GBV risk mitigation something that's their own. So we do encourage, of course, joint work, but you have 2 resources so you can tailor training and work to the different audiences and needs. Next slide, please. So let me just give some examples of language. And this is just to share with you so that whatever your role is, you could be more mindful. If you're a GBV specialist, if we say things like MAP referral pathways as part of your M&E. That might have a totally different meaning to a person in the nutrition or health sector than what you mean as a GBV specialist. Or if you say, do a risk assessment, again, that might mean something different. Ensuring the active participation of women and girls, we really need to explain in detail what that means. Otherwise, it's not useful guidance. And on the other hand, for non-specialists, be patient with GBV specialists because we do not know a lot of the information and phrases that are part of your everyday work. IPC, PEP kits mean something completely different to a GBV specialist than you might have for another sector of health, for example, or MABs and cash. So really, GBV risk mitigation is a dialogue between specialists and non-specialists coming together to create a common language and indicators that make sense to both groups of people. Next slide. We also learned, as I mentioned, we're not so good at training GBV specialists, and we're trying to get better at that. So that huge guideline, the GBV guidelines, is 350 pages. If someone gives you that and you're not a specialist, please ask them for the poster or checklist because there's simplified tools available and it should be easy to understand. It's also important to remember that it's not just training on the numbers or grabbing the resource and knowing what indicators, but the process, and we should practice together doing the actual risk mitigation monitoring exercises. So if we go to the next slide, please. I'll just share the PowerPoint. I know we're getting close to time. This is an example of a scenario exercise you can do together. Take a photo of a site that is where your projects are. Go and find the page in the GBV guidelines, choose your indicators, identify how to collect the information and how you'd share this, and really do that together with your specialist and non-specialist sitting there together. So this is a WASH site, so you'd go to the WASH guideline and look at those indicators. On the next slide, you'll see, for example, in the Pacific, so non-cluster context for the most part, we have evacuation centers. And so if you're from IOM, for example, you might be developing checklists using the CCCM portion of the Interagency Standing Committee guidelines and using those indicators, or you might even develop some of your own with the GBV specialists in your area. Next slide, please. So the last is just to make any GBV specialists on the call aware that we have our own set of M&E indicators to monitor how we're doing our work. And this is the list here. Going back to the very beginning of the presentation, GBV specialists have the role to take that system-wide approach. So for example, our indicator is how many of the clusters actually have a focal point, and how many of the clusters in the humanitarian response plan have integrated the monitoring and evaluation indicators from the GBV guidelines. So these are how we measure, are we doing the best job that we can as a whole system, both specialist and non-specialist together. I hope that was helpful, and I'll hand back to Irene now.
Thanks so much, Leah. Ashley, that was so informative for us. So moving to our country case study, should I give the floor to you, Selena? Is it Selena or Estelle? For South Sudan? And I don't know if I froze or is Selena froze. Estelle, would you want to come in?
It is Selena, but I mean, I think she froze, right?
Yes, let's give her a bit of time.
Yeah, but otherwise, I mean, let's give, yeah, if you don't mind, let's just give her So Minif, I'm gonna check on her, otherwise I can start.
Are you good, Selena? So for everyone, we're also trying to accommodate questions. Please feel free to type in your questions in the chat box. I think she just dropped off. I don't know if you want to start, Estelle.
Okay, let me just go quickly through my notes, and then I can get back to you.
Sorry, I'm
No.
back.
Okay,
I think it
Oh,
was from
perfect.
my side. I'm really sorry
Go ahead.
about that.
No problem. Go
Inconvenience.
ahead,
Hello
Selena.
again. I'm going now, towards the end of this webinar to present a study that was done by UNICEF to measure the GBV risk mitigation interventions in South Sudan. Next, please. So to start with, this builds on actually existing and growing knowledge base on the relationship between nutrition outcomes and GBV risks and actual GBV incidents. But to measure the effectiveness of GBV mitigation strategies, this has been the first study of its kind globally. It had tested the effectiveness of GBV nutrition programmatic package, which is basically risk mitigation package. And then it had significant programmatic and policy implications, not only for South Sudan, but also beyond. So if we can scroll please to next slide. So, and here are the research questions. So this study looked at GBV risk mitigation interventions with its relationship with the perceptions of safety for women and girls when they access nutrition facilities, and how does it affect their use of nutrition facilities? And the third area is if there is any improvement in the performance of nutrition services compared to other facilities when they are putting in place measures from the GBV nutrition programmatic package. So mainly these were the three areas that were assessed. Next, please. You will see in the next slide the theory of change that was used to build, the whole study on. You will see in pink in the first three columns, these are the common GBV risks. And then in the next column, you will see GBV, the actual GBV forms, etc., that are linked to these risks. And then you will see in green the risk mitigation activities that are linked to the risk to mitigate it. In gray below, you will see that there are some risk reduction strategies that are used and utilized by the women and girls themselves. So it's not from programmatic intervention. And then you will see at the end the outcomes and the impact. So again, the whole study with the three questions was built on this theory of change. I will give you now in the next slide a glimpse of the GBV nutrition programmatic package, again, which is basically the GBV risk mitigation interventions. So these are some of the most important items in this package is, doing safety audits, which leads to site-specific improvements, whether that is in the structure, but also in the service delivery modalities, affecting the staffing and capacity considerations, making sure that there are enough female staff in nutrition facilities, doing periodic consultation with women and girls, also working on strengthening the relationship and referrals among nutrition and GBV, and working on community awareness and engagement. So with that in mind, this study was done. The methodology that was used was Kawasai experimental. We had compared locations which have implemented these interventions from the GBV nutrition programmatic guide versus locations where they didn't implement anything. But also, we also measure the pre and post. So pre in locations where these interventions were put in place, we took a baseline and then we did post assessment. And there were, of course, mixed methods that were used qualitatively and quantitatively. So having said that, this is a formal research. So the ethical approval from South Sudan Ministry of Health, ethical review board was taken. There was training for enumerators on the GBV, how to handle GBV disclosures, if any, how to refer, etc. And what was also ensured that gender balanced enumerator teams were formed, making sure that there is enough female enumerators. But also to give you now a background before we start going through the results. In the next slide, I will give you a background on the access challenges that were reported in South Sudan, specifically for women and girls accessing nutrition facilities. And as you can see, there are a number of significant access challenges, whether that is related to the geographical or infrastructural barriers. They need to walk a long distance, there is flooding, transportation, etc. But also there are societal and cultural barriers, like the restriction of females in the household to leave their responsibilities at the household level to go and receive the services. There are security concerns en route, and there are GBV risks at home. They're in relation of the dynamics in the household with relation to access to nutrition, and service-related barriers, whether that is the delivery of supplies, absence of necessary medication, etc. So having this in mind, I'm going to move now to the results of this study. Again, I'm just giving you an overview, but please feel free to go ahead and look at the whole thing. It's very interesting. So when it comes to impact in general, there was an appreciation of the actions taken to improve safety and access. And so both intervention and control groups, interestingly, reported significant increases in actions taken by nutrition facilities. So in both groups, they took more actions to mitigate GBV risks. 82% of women and girls said that risk mitigation actions had made them feel safer, so a better perception of safety when they are receiving nutrition services. 2.5-fold of women and girls who were assessed said that they noticed there is an increase, by 2.5-fold in noticing actions taken to improve safety and access. There are particular elements of the GBV risk mitigation measures that were put in place that were found highly significant for and correlated to the perceptions of safety. And these include infrastructure changes, delivery modalities, and staffing considerations were really found highly correlated to feelings of increased safety. Next, please. So here is just a highlight of what some of the respondents said. As you can see, having women staff have really been one of the key elements of enhancing the perceptions of safety for women and girls when accessing nutrition services. So I'm going to look now at with the next slide. I'm also going to speak about the way we measure the proximity and collaboration between nutrition and GBV services towards multiple domains. The results show that where there is high GBV services, meaning that it's not far and there's high collaboration between nutrition colleagues and GBV colleagues, it has been noted that there were more referrals in both directions, higher reported perceptions of safety, and again, it comes up again, the female staff were reported to be more available. So whenever there is more coordination and enhanced, collaboration between nutrition and GBV programs, female staff were becoming more and more present, and also, the proportion of respondents indicated feeling concerned about sexual harassment and nutrition sites was less than half at the sites where there are female staff present, again highlighting the importance of having female staff in nutrition facilities. Next, please. I'm going to now go through the unanticipated spillover effects. So while these were not initially thought to be the components that would be under the control of nutrition, the nutrition sector, or these were not things that were identified as elements that the nutrition sector can actually affect. However, we have found out during the study that after implementing the GBV nutrition package, there were improved perceptions of safety en route to the nutrition site. There is improved family and community dynamics around accessing nutrition services, and it's related to the household dynamics and how women and girls are were more accepted to access these services, and then community-initiated interventions to enhance safety, noting here the role of community leaders into pushing the community engagement and the enhancement of safety of women and girls when they access nutrition services. So as a conclusion, and to answer, the research questions, both qualitative and quantitative findings indicate that the GBV risk mitigation package was associated with improved safety and access among women and girls who were assessed and access nutrition facilities. It also shows what I think all or most of the nutrition and GBV professionals have observed through the years, that GBV is actually very deeply linked to nutrition, and that by proactively and purposely putting and addressing GBV risks and putting in place GBV risk mitigation measures, actually nutrition programs, not only the risks can decrease, but nutrition programs will be better positioned to deliver optimal results for women and girls. So I'm going to hand back the floor to Irene.
Thanks so much, Selena. Thanks, everyone. Thanks to all our experts for today. Selena, of course, Estelle, and Leigh Ashley, and of course, Sarah, for their time and expertise, for allowing us to share their time and expertise with us. I'm opening the floor for Q&A. Feel free to unmute yourself, or you can type in your question. Quite a very interesting discussion. No questions for our experts. I mean, this is the time that you have them. They're quite busy. Everyone is quite busy. I don't see anything. Yeah, okay. Let me just. Leigh Ashley is saying she loves questions.
Thanks so much, Irene. For me, it's not a question per se, but I just want to thank our fellow presenters for very insightful presentations. I think that provide practical kind of examples in terms of GBV risk mitigation programs. Thank you.
Thank you so much. Well noted. And I sincerely also appreciate how it reflects how we can do GVB work in other sectors as well. But as mentioned by Lay Ashley, you don't need to be a specialist to do and highlight GVB indicators. Thank you also for sharing all the resources coming from all colleagues and all experts today. Just opening the floor. I don't know if Selena wants to come in, Lay Ashley wants to come in, or Estelle, or even Sarah. I mean, final notes from everyone, given no one is wanted to come in. Go ahead, Lay Ashley.
I was going to ask a question to the floor, so I'm flipping the tables and asking participant questions. But I guess my question is, I really want to know, what are the challenges you face with MNE? Because I think we have these beautiful guidelines, and it can be challenging to implement them, right? So I'd really like to know. I can speak, from the Pacific side and the fields. When we're talking about short-term emergencies, not long-term, just keeping our eye and making sure these risk mitigation indicators are in programs can be a challenge, right? And actually, I think for here, it's almost easier to implement them in systems level and harder at program level sometimes. But I wanted to know what challenges others face with MNE and GBV risk mitigation.
Thanks so much, Lay Ashley. I almost wanted to ask that question. I can see colleagues here from UNICEF, UNFPA, and IOM. Anyone can come in. What are the challenges you're facing? Given the many resources that we have, obviously this is not... Go ahead, Chris.
Yeah, thank you, Lay Ashley and Irene. One challenge that I've noted, particularly in UNICEF, in some of the country offices that I collaborate with in South Asia, is undertaking GBV risk mitigation beyond the child protection sector. So we have seen a lot of progress in the child protection sector, but it's been a challenge in the other sectors like WASH, maybe education, for them to forge ahead with this agenda. So I think it's also to do with maybe inadequate capacities within those sectors, and maybe they need more support, even from child protection and also from the GBV experts. So I think that has been a prominent challenge that we need to address.
Thanks, Chris. Anyone else? I know I've seen in the chat, underreporting is also an issue. Obviously, I think referring to the survivors data. But aside from that, outside our survivors data, what else in terms of indicator challenges you see? I don't know if Go ahead, Selena.
Yes, thank you, Irene. So I might have a piece that can answer the question about underreporting or this concern, is that we have seen that across all sectors, and specifically non-CP sectors, is that they actually do some GBV risk mitigation interventions and measures, but they are not acknowledged as GBV risk mitigation measures. So that could be, making sure that the proximity of services is close, or making sure that the opening times are not like during daylight, etc. But they are not when they when it comes to M&E, these are not acknowledged to be linked to GBV. So I think it's a key to have all year coordination and collaboration with other sections, particularly if they are in the same office, to make sure that there is a common understanding of what that means. And actually, many of the sectors, I can just now on top of my mind to speak about WASH, they do have in their own sector-specific guidance a lot of GBV risk mitigation measures that are already there. Maybe not termed as GBV risk mitigation measures, but for M&E purposes, maybe more collaboration with other sectors can be helpful. Thank you.
Thanks so much, Selena. Very insightful. I don't know. I know there are M&E people online, not specifically GVB specialists or not. I don't know if they want to come in as well as an M&E expert. What are the challenges you have? Where we can provide support? Acknowledging capacity and support is lacking sometimes. Or maybe we don't have them anymore. I know some people are need to jump off. Any last words from our colleagues? I don't want to call out names, but yes, go ahead, Estelle.
Yeah, maybe just 2.1 to also build on what Selena said about not necessary in naming or labeling risk mitigation interventions as mitigation as we say it in the GBV jargon. This is clearly one of the things that we noticed when we were developing the menu of measures for the education sector. There's a lot of interventions done by the education sector, for example, that will be labeled as risk mitigation. It's not even risk mitigation. It will be called, for example, prevention activities, or like when we usually highlight some interventions to be done under risk mitigation, let's just say the code of conduct, for example, for schools, those are things that are already existing in the education sector standards, but they call it prevention interventions. So one thing that we really made sure to explain in the menu of measures is regardless of the terminology that we use, whenever an interventions contributes to, improve access to education, improve retention in school, or, help for safer programming, it is actually risk mitigation. So sometimes sectors are a bit how can I say, I don't know, maybe there because our jargon as GBV person, sometimes it can be very intimidating. So it's also somehow for us to try to adapt our language to the sectors we are working with, right? And not just come as, well, this is risk mitigation, this is what you have to do. We need to also acknowledge what other sectors are already doing to contribute to a safer programming. That's one point that I wanted to say. And then maybe just one last point about the education menu of measures. I mentioned before that it's gonna be field tested in Chad and Burkina Faso. Those are two countries that are currently going through the renewal of a specific program that is called a multi-year resilience program. It is supported financially by Education Cannot Wait. It is something that we wanted to have that collaboration with countries that are going through the MUP process. But as I was saying before, we also want to field test this in I mean, other contexts like development contests to see how the tool can also be adapted, you know, to programs that are not specifically emergency program. So if any country in the I mean this region is interested, we are clearly open to that. They can feel free to reach out to me. We can try to see how concretely this can be put into place. The work in Chad and Burkina Faso gonna happen next year around January or February. So yeah, yeah, that's what I wanted to say. We're really open to go beyond education in emergency. Thank you.
Thank you so much, Estelle. I'm gonna check one more chat and then Chris, do you want to come in? I have few more minutes before I'll allow Sarah to wrap us up.
Okay, thanks so much, Irene. One other challenge that I have also noted, particularly at field level, at implementation level, is for colleagues to differentiate or distinguish risk mitigation interventions from prevention, because at times they look like, in a way, they do overlap. So if there could also be more clarity, I mean, around that, I think that could be helpful. Over.
Giving the floor to Lay Ashley. Go ahead, Lay.
Yeah, no, look, I couldn't agree more. I mentioned that study we did, and that's one of the things that our study showed. Exactly. There's a lot of clarity among, lack of clarity, sorry, among GBV specialists themselves who work in that space, and the distinction. We did develop some materials on that are sitting with the Global Interagency Standing Committee guidelines. They developed a course just for GBV specialists so we could get our own language straight between prevention and risk mitigation and also explain it more clearly. But I can say that in the Pacific, we're rolling out jointly UNFPA and UNICEF a training package. And this is one of the things we've really been spending our time on. What is the difference? But what is the most important thing? Why does the difference matter? And it matters because of time and urgency, right? Like, because we would have people saying, you know, I'm going to change social norms. You can't change social norms in a 3 to 6 month emergency, flooding or cyclone. And that is, I think, why it's so important that we clarify what risk mitigation is. And as our colleagues have said, there's so much already happening that they may not be aware of reduces risk. So if we can pull on that and build on that, so those immediate urgent mitigation measures can take place, I think it will make a big difference, you know, to women and girls. So over from my side.
Well said. Thank you again to everyone who joined us. Thank you to all our panel of experts who provided their time and expertise today. I've launched the poll questions for today. Please feel free to feedback on us on this webinar. I will move you over to Sarah for the wrap up and summary of the session. Go ahead, Sarah.
Thank you, Irene. And I think we have one more slide with the key messages. Great, thanks. So really, we could have made many, many slides with the key messages. There's been a lot said today that I think is key, but we're just leaving you with a couple here. One is around promoting the collection of disaggregated data. If we don't know sex, age, disability, other context relevant factors in the data that's being gathered, it's quite hard to monitor risks. And this is something that I think we say a lot. I think we've all heard this over and over, but it's surprising how often we're still, you know, not quite following through on it. Also a key message, this came up, I believe, as during Selena's presentation, number of cases, not using number of cases, number of survivors as any sort of target or indicator for any sector. This is really important for safety and security for survivors. And then lastly, encouraging the use of qualitative data. Lee Ashley touched on this. This is really how we can complement what's coming from the quantitative data, and it really lets women and girls' voices come through so we can hear the details of what they want to tell us. I also wanted to share with you some materials that UNFPA is promoting during 16 days that you see on the right of your screen. Really having this webinar during 16 days highlights that it takes all of us, GBV specialists, as well as other sectors, to collectively mitigate GBV. And so during 16 days, UNFPA is highlighting some stories and resources and tools each day through our social media, and I wanted to share 2 of them with you. Understanding TFGBV in Asia is meant to equip us to better identify the risks that are associated with technology facilitated abuse as it moves from online to offline. And this is something that every sector, again, has a role in mitigating. And the survivor-centered M&E publication that you see there has useful guidance, some of it more towards response, but I think there's still useful guidance there to ensure that we do no harm through our M&E in any context, whether it's humanitarian or development. So thank you so much for your participation. Thank you, Selena, Estelle, Lee Ashley, and I wish all of you a happy and productive 16 days, and I'll hand it over to Irene, and thank you, Irene.
Thanks so much, Sarah, and thank you for organizing. Thank you for all partners for today's webinar from UNFPA, UNICEF, IOM, the PSEA, the working group, and of course, our lead agency for the last webinar for the year is UNFPA. Thank you so much. I know everyone is so busy, but thank you for taking the time. I will share the recording once it's available, including all resources, and of course, our experts' details for you to be able to contact them again. So thank you again. Have a good day. Bye, everyone. Thank you.
Bye. Thank you.
Thank you, Irene. Bye-bye.
Thank you, Chris. I think, let me just take out some of our colleagues. Just close the webinar.